Hello, this is white blood cell diseases part 1, presented by the SchrDbb, with reference Color Atlas of Hematology by Harald Thelm. So here we're going to visualize abnormalities of white blood cell series. So the first thing is this. So you need to know that there are different differential diagnoses of abnormalities in white blood cells. The differential diagnosis, the diseases of white blood cells can be divided with the round to oval cells, round or oval cells predominating. This actually just means that it means that there is more agranulocytosis than the granulocytes. Is it clear? So when there is more agranulocyte than the granulocyte, these are the different diseases that are going to be explained. So agranulocytosis than granulocyte are going to produce this disease, or you can just call it more round to oval cell predominance. So is it clear? Now the next one is the differential diagnosis now, and the differential diagnosis that the granulocytes predominate more over the agranulocytes. And now this is the granulocyte can usually have segmented cells, so that's why we talk about segmented cells predominating. So let's see the first case where the agranulocytes predominate more than the granulocytes, or the round to oval cells predominating. Now you have the first one is reactive lymphocytosis. Is going to be in this case. You have reactive monocytosis. You have lymphatic diseases such as lymphomas, lymphocytic leukemias. The next one, you have acute leukemias, including episodic chronic myeloid leukemia, but chronic myeloid leukemia is more in segmental cells predominating, though chronic myeloid leukemia has a certain part which is also in round to oval cell predominating or agranulocyte predominating. Now the next one is low count of cells with segmented nuclei. So there are certain cases where the agranulocyte can become low count. Where the granulocyte become high count and the agranulocyte become low count. Why? But the agranulocytes do not actually increase in number. It's because of the decrease in number of the granulocyte that the agranulocyte are perceived as if they are more than the granulocyte. So in this type of disease, we have agranulocytosis in cases of aplastic anemia or myelodysplasia. Aplastic anemia and myelodysplasia are going to reduce the number are going to increase the number to reduce the number of the granulocyte. So you are going to have an agranulocytosis. So are you clear? And also an agranulocytosis occurs when you also have a decreased level of neutrophils. Is it clear? So all this, you have an increased level of comparative agranulocytes than the granulocyte, not because of an increase of agranulocyte, but instead because of the decrease of granulocyte. Now, the next we have differential diagnosis of granulocyte. In this case, it's differential granulocyte. We have reactive processes, chronic myeloid leukemia, osteomyelosclerosis, and polycythemia vera. Now, before we continue on this tutorial, I want to give a brief explanation. You need to know that generally there are two main types of cancers inside in hematology. We have leukemias and we have lymphomas. Now you need to know that there are not actually two main types. There is leukemias, there is lymphoma, and there is plasma cell tumors. So those are the three main types, and we also have monocytes or macrophages tumor. So those are the four main types of cancers. Now you need to know that when we speak about leukemia, they are mostly involved in the bone marrow. It means that the abnormal cells come from the bone marrow. Since the abnormal cells come from the bone marrow, that is why leukemias is going to result to an abnormality in hematopoiesis, which occurs in the bone marrow. So when you have abnormals at the beginning of leukemias, usually it is very severe because it is reducing the numbers of the blood cells which are produced normally in the bone marrow, because it's excessive abnormal leukocyte, excessive abnormal lymphocyte that is going to impair the hematopoietic process of the other cells. That is for leukemia. Now you need to know that what leukemia is divided into two. You have the myeloid leukemia and you have the lymphoid leukemia. The myeloid leukemia comes from the myeloblasts, and you have already seen the hematopoietic process of the myeloblast, and from the myeloblast was produced the different granulocytes. You have the eosinophils, you have the basophils, you have the neutrophils, all that are produced from the myeloblast series. Now in lymphoid leukemia, it is involving the lymphoid pathway, the lymphoblast cells. Is it clear? So everything involved in the lymphoblastic series, like the production of the T cells, the production of the B cells, are going to be involved with the the lymphoid leukemia. So generally, that's that you have to know. Now the next thing is lymphomas. Lymphomas, actually, they are cell tumors which are produced at the level of lymph nodes. Is it clear? So their primary derivation is at the level of lymph nodes. That is for lymphomas. So at the beginning, lymphoma may not involve the bone marrow. They will not involve the bone marrow. So the patient is not going to be very severe at the beginning. It's only at the end, when the cancer have metastasized to the bone, that the pathology becomes very severe. Is it clear? Now the next cancer that I want to speak about are plasma cell tumors. Now plasma cell tumors are involved now with abnormalities of antibody production. Is it clear? So when you have abnormalities of antibody production, those ones are called plasma cell tumor. Now you need to point out the fact that the B cells are the ones which are involved with the production of antibodies, and when they are becoming memory cells to produce antibodies continuously, they are called plasma cells. Now you can have tumors now with plasma cells, like in the case of multiple myeloma. And in multiple myeloma, you're going to have excessive secretion of the kappa and the light chain. Sorry for that. You have excessive secretion of you're going to have excessive secretion of antibodies, heavy and light chains of antibodies. Is it clear? So those are the case of the plasma cell tumor. The next thing is that you have the case of histiocytosis, and histiocytosis is when you have macrophages tumor. Is it clear? Those are the four main cancers of the blood. So in addition to that, we have different cancers of the blood, and we're going to continue to see it. So that's it. So the next thing that we're going to visualize now are the different tumors which are at the level, the different tumors which are at the level of an increased level of granulocytes. So we start with the next part later. Thanks for your kind attention.